on the physicians, those who did MB-CHB. Their training was focused on medicine. If you look at the curriculum for a medical physician, or even a surgeon, or even a nurse, their curriculum only have 1 unit or 2 of nutrition. Nutrition course takes 4 years for a degree, 3 years for diploma, and 2 years for certificate. So one cannot have principles of nutrition and purport to be nutritionist. So we have seen cases where doctors are now shifting from their usual practice to get into advisory matters on diet. And that is why we are saying we are not going to allow them, because they are regulated within their medical profession, particularly for the physicians. And the nutritionists are also regulated. And they cannot be accountable for the statements they make because they lack that training and registration. So if a doctor wants to handle matters of nutrition, this is my piece of advice. Let them go back and register from first year in the university and study nutrition for 4 years. If they cannot do it at degree level, let them go and register for diploma and study for 3 years. Or they do certificate level and study for 2 years. If they do that, we will be happy to register them, because we are looking for more professionals as nutritionists and dietitians. And we'll allow them to go on platforms and talk about nutrition. And I want to condemn, with the strongest term, one of the surgeons that we saw on news talking about diet in cardiology. They need to have an expert in nutrition sitting beside them, so that the expert can be accountable to the statement being made, not the medical doctor. Thank you.
And what are some of the sanctions maybe referred upon those who are...
The law is very clear on Section 32 under miscellaneous provisions of the Nutritionists and Dietitians Act. Anybody who is not registered and is found to be behaving in a manner that they want to directly or indirectly advise technically on matters of nutrition and dietetics is liable for conviction in the court of law and penalties associated with it. So we will just look for police and arrest them. And then they will go and deal with the prosecutor, because we have the mandate of the Act to specify what kind of criminal offense they are engaged in. So for me, I say those are criminals by Kenyan law standards. Thank you.
Thank you.
Or a CEC health. But we still have this stereotype that the medical doctor is the most important cadre. And that is why they think that they can also handle matters of nutrition and handle any other matter when it comes to the public health matters. And this is the reason why they have even misadvised the Ministry of Health. So that some of the things that are being executed, the shortfalls is because the physicians take lead in almost everything, when we are sure that their training was actually based on the human person. There was no soft skills. So they lack soft skills, but they still insist that they can become better leaders. So what we are saying is that we want them to know that the profession is protected by the professionals themselves. And the professionals are equal to the task. They can handle the matters within their training framework. 72 units of nutrition and dietetics is not the same as 2 units of nutrition. So they do their medicine, they leave the nutritionists to do their nutrition.